Hi everybody, my name is Tatiana Williams and I'm going to be talking to you today about the possible entry-level change of an athletic training. As for credibility, I've been studying athletic training in college for about 2 years now, and I've been researching this topic since high school and have been keeping up with any new information that concerns the topic. The purpose of this speech is to inform you of the lack of knowledge that is going on in the field of athletic training. And I'm also going to be telling you guys about what actions are being taken to fix this problem. This topic can relate to just about anyone because athletic trainers are everywhere, from corporate office gyms to the gyms your daughters practice at after school when they go to basketball practice. If you don't use the services of an athletic trainer, the chances are anyone you know will. So the initial problem that I'm going to talk about here is the outdated curriculum that is being used today to get students through schooling for athletic training. Beckett and Delforge said athletic training can be traced by 50 years of change, maturity, and emergence. Since the original curriculum for the field of athletic training was created and published, there has been an abundance of changes that have occurred throughout that time. The main problem is that some of these changes that are being made in the world of athletic training, some of them are being added to their curriculum and others are not. Even though it's very vital information that people need to know, it's just not making it into the cut of what's going to be squeezed into those 4 years when you are studying for athletic training. For example, in 2006, there was an expansion in the curriculum into non-orthopedic areas of medicine. Doctors decided to add studies of the trauma and reconstruction of limbs into the courses. Also, this could be added to the expansion and revision of the curriculum, but the plans that were made to add that into the curriculum still hasn't been fully processed, so it's excluded from the curriculum now. Mm-hmm. And just that example right there shows you how outdated it is, because that was planned to happen in 2006 and it's almost 10 years later now. So due to the change in new discoveries over the years, the curriculum for athletic training is very outdated and it's leaving students blind after they graduate and go into the work world. Wow. All in all, an extra 2 years of schooling would really be a better way of defining students' expertise when they start going into that field of athletic training out of schooling. So the National Athletic Trainers Association has been making efforts to change this. They want to change the entry level from a bachelor's to a post-baccalaureate degree, or in other words, a master's degree. New courses are being introduced when getting someone's post-baccalaureate degree for athletic training in the expansion and revision of the curriculum. Courses such as the Emergency Action Plan, clinical training, and many other courses are being planned to go into the curriculum to expand it to where the students are getting all the information they need after they're done with schooling, so they don't go out into the field blind, like I said. These courses will teach the students much more beneficial ways to treat the patients. I really wanted to talk to you guys about the emergency planning course that is not a part of the curriculum right now, but I think it is such a vital course for athletic training that everyone should know about, but it's not being taught to the students. So basically, this course is meant to teach the students what to do when an unexpected situation occurs. Like, for example, if someone's doing a physical activity and they happen to stop breathing, or a really bad neck or spine injury occurs, or there's severe bleeding, or even a stroke. The athletic trainer must know what to do in that situation. Overall, emergency planning course could prevent a potentially limb-threatening or life-threatening outcomes of injuries. Wow. Along with prospective life-saving, added courses like these will provide a greater expertise in patient care in the athletic trainer's profession. So there are many benefits that can result in an entry-level change in the field of athletic training. Athletic trainers are needed to ensure that patients are taken care of to the best of their capability. So if they're only going through 4 years of schooling and they're going out into the work field blind, like I've said a few times, they won't be able to do everything they can because they don't have that knowledge. So with an extra 2 years of schooling, and if they do have their post-baccalaureate degree, they will be able to take care of a patient to the best of to the highest level that they can. The National Athletic Trainers Association will specialize in patient education to prevent injury and re-injury, which reduces rehabilitative and medical costs for the patients. This results in an improvement of patients' functions and physical outcome. So it makes everything much quicker and much easier for the patient. They're just trying to do what works best for the patient to be sure the outcomes of their injuries or whatever it was is the best, so they have the best recovery. Changing the entry level will ensure that the profession of athletic trainers would be more beneficial to the patients. It will also move this profession a step higher in the medical field, making it viewed as a much more important occupation than it is now. So an entry-level change in the profession of athletic training will greatly improve the program, resulting in much higher accreditation for the field of athletic training. So today I've talked to you guys about the problems that the National Athletic Trainers Association is going through, and with the current entry level that they have at a bachelor's degree, and the efforts they're putting forward to change this, and also the benefits that will come out of everything. With changing the entry level from a bachelor's to a post-baccalaureate degree, athletic trainers will have more of a mastery in their field of study, which will result in a greater and more effective patient care. So thank you for your time.
Thank you.